Hello, dear students. This video is about spotting in community medicine practical examination. As the season for practical exams is going on, I am Dr. Shafee, professor in Department of Community Medicine at JIIU's IMSR Badnapur, Jalna. So, in this video, we will see about the distribution of marks in practical examination and one section of spotting. In last two videos, we have discussed about the spotting. First section was on vaccination, second was on nutrition. Please watch those videos because they are very important and from them also spots are kept in your examination. So there are total 100 marks allotted for community medicine practical exam and marks distribution as per NMC and MUHS are clinical social case 20 marks, epidemiology and statistical exercise 20 marks, spotting 20 marks, skill assessment 20 marks, and grand viva 20 marks. So this section deals on spotting or spotters. So there may be 4 to 10 spots kept of 5 to 2 marks each. And these are the sections from which usually spots are kept like vaccination, nutrition, family planning, entomology, water, biomedical waste management, mother and child healthcare, meteorological environment, and other photographs which are whichever figures or photographs given in the park will also be displayed as the spot. So we'll talk about the family planning methods or contraception. In this section, one or two spots will be kept in your exam, and always you'll find that the spot will be there from contraceptive methods. So we know that there is a classification of family planning methods is being given. So these are the questions which are usually asked one spot. Two questions minimum will be there. So usually first question asked on family planning methods or contraceptives is the type of family planning method. So you need to know the classification of family planning methods or contraceptives in detail. Then there will be one question on write down the mechanism of action. So particularly for hormonal contraceptives and intrauterine devices, they will ask the mechanism of action. For each spot on contraception, they will usually ask what is the failure rate. So you need to write down the Pearl's index, that is number of accidental pregnancies divided by the total number of users who are using contraception into 1200, and the unit will be 100 woman years. So is this 100 woman years indicates or means that the 100 women are followed for a period of 1 year. So if 100 women are using contraceptive methods, how many of them they get accidental pregnancies? So that will indicate the Pearl index or failure rate for that particular type of contraceptive method. Then indications depending on the type of couple, newly married couple or couple who are having one child or couple who are having two children, which type of contraception is indicated, you need to write down. So usually indications will be asked for IUDs and hormonal contraceptives. Then contraindications also will be there for hormonal contraceptives and IUDs. And usually they ask also on complications. So the pictures displays the barrier contraceptive methods like male condom, female condom, diaphragm, cervical cap, wall cap. So these are any one of them can be kept as a barrier type of contraceptive. Then they will ask you failure rate and how will you advise the couple to use it. Then second type of contraceptive methods are hormonal contraceptives. So we have oral hormonal contraceptive, we have vaginal ring, birth control patch or dermal implant, then injectable contraceptive in the form of DMPA, and I pill. I pill is usually kept because it is an emergency contraception. postcoital contraception. So these are various hormonal contraceptives which are kept in the spotting. So on these also they will ask you the failure rate, mechanism of action, complications, indications. Then these are the intrauterine devices. So at present we get two type of intrauterine devices. One is hormonal iodine and second is copper IUD. And some copper IUDs are also medicated, means they have the hormones on it. So that is also available. So in IUDs also they will ask you about the indication, failure rate, complications, side effects after using it, what is the reason for expulsion, of how to follow whether the property is in place or not. Such type of questions will be asked on intrauterine devices. Then permanent method of sterilization, we have female sterilization, that is tubectomy, and we have male sterilization in the form of vasectomy. So modified Pomeroy's technique is usually used for doing tubectomy, and no scalpel vasectomy is the technique used for doing vasectomy. So you can see the site of tubes being cut or the vast difference where it is being cut. So usually they will ask you what is the indication of hormone sterilization, then what is the failure rate, what are the complications after doing these surgeries. So all these questions will be asked on permanent method of. Then sometimes, very rarely, they keep the natural contraceptive methods. So any of the method, usually this is standard more days method or that monthly chart will be kept and they will ask you about that, but it is rarely asked. So this is the classification of contraceptive methods. Spacing methods first we have, then we have terminal methods. Spacing methods are reversible, terminal methods are irreversible. So spacing methods, we have barrier methods in that physical, chemical, and both combined. Now male condom or female condom, they are combined actually. So make chemical is also present on the toe. Then intrauterine devices, hormonal methods, post-conceptional methods here written. So post-conceptional methods, they include menstrual regulation, menstrual induction, oral abortifacient, or medical termination of egg. Then miscellaneous like natural and terminal methods, we have male sterilization and female sterilization. So these are all the various types of contraceptive methods. Any one or two will be kept in your exam. So this is all about the spotting on family planning methods or contraceptive. I request all of you please subscribe my channel, like and share the videos, share these videos among your student community. Thank you.